nursing, it is essential to create a good care environment for patients, and this following video explains why. There are multiple factors within the care environment which support patient-centered care, including a functional environment which has shared power between team members, effective systems of organisation and communication, which enables functional allied health care teams and the potential for innovation.
As stated in Reference 1, person-centered care is understanding and respecting that patients have different wishes and perspectives, cogitating the patient's attributes and beliefs, and involving the patient in decisions of their own care. The care environment, along with nurses' own attributes and nursing practice, determines a nurse's ability to provide holistic person-centered care. The Australian College of Nursing defines person-centered care as having several interchanging elements that determine the quality of care provided in the healthcare setting. These elements include recognizing the patient as an individual with their own personal preferences, respecting a person's right and protecting their dignity, and building a therapeutic relationship on trust and understanding between the nurse, care provider, and patient, care recipient. In addition, Reference 1 explains that person-centered care is facilitated by a nurse who is emotionally and physically present and available throughout the time that the care is administered. This allows the nurse to be able to closely observe and detect where and when physical, social, and emotional support is required. To be able to understand and apply these concepts into professional practice ensures elements of person-centered care are formed, subsequently fortifying them in clinical setting.
The appropriate care environment is very much a crucial aspect when aiming to implement a holistic approach to person-centered care. Therefore, the key contributors to person-centered care, particularly in the care environment, can be categorized as being in relation, being in place, and being with self. The direct roles played by nurses influences and encourages the paramount relationships between the patient and all others who are important to the patient, whether that would be other allied health professionals or family members. By aiming to fulfill a healthy care environment, the integral support system and relationship between nurse and patient is established through integrity, self-reflection, and the flexibility of values based on this reflectivity. The interaction between colleagues and patients and colleagues also largely forms the framework of the mental aspect of the healthcare environment. Whilst obliging to care relationships and professionalism, respecting and understanding the context and limitations of the working environment is an imperative contributor to the care environment. Hostility induced by internal disputes in the care environment will therefore be prevented, ensuring that the patient's well-being is the primary issue at hand. When considering organizational values, upholding industry standards for aspects like hygiene should be mandatory, as not only to abide by the codes of professional conduct, but to also guarantee the utmost optimal care which is being delivered to the patient. Facilitating person-centered care also deals with the significant responsibility of decision-making, being with self. In pertaining to creating a safe and beneficial care environment, the values and preferences of the patient must be understood from the patient's point of reference, in conjunction with clinical expertise and effectiveness. Patients are, after all, still human beings and should feel comfortable, safe, and trust that the person-centered care environment is implementing the best action plan to address their needs. The nursing profession requires nurses to continually utilize and develop their level of competency by using quick decision-making, knowledge, understanding, and skills to create a suitable care environment for the patient. Some of the challenges that healthcare professionals face in developing their competence and performance are that there are still barriers to the universal acceptance of outcomes-based approaches to professional nursing education. Due to this, the key leadership challenges that occur for healthcare professionals in utilizing and developing their competency level skill is aiding in the learning and acceptance of outcomes-based approach to nursing. In addition to this, nurses also face the challenge of making sure all healthcare professionals implement the competency-based approaches needed for a proper care environment.
Hey Molly, how are you feeling today?
Hey nurse, I've got a really busy head.
Oh, that's no good. I'm just going to check your pulse if that's okay.
Yeah, no worries.
Did you have lunch today?
I didn't eat much of it, to be honest. I just had a little bit of yogurt.
Oh yeah, that's no good. Do you have any other problems? Have you been feeling sick lately? Or
Nah. Yesterday, also had a similar feeling, busy.
Alright, well I'm just going to speak to the doctor. I'll just be back in a second.
Yep, no worries.
To implement a holistic approach, nurses must assess every aspect of the patient's health. This can be done by addressing all the patient's current and future needs. One of the leadership challenges that nurses face with holistic care is that nurses need to have an informed understanding of the diversity of health beliefs. This means that nurses adapt their methods of care and treatment plans to suit the individual patient's ever-changing wants and needs. Moreover, nurses also face the challenge of providing other healthcare professionals with informed information in regards to each patient's unique culture, beliefs, and values, and that each individual should be treated with respect and courtesy in relation to their health beliefs. Nurses can do this by establishing positive, productive, and unprejudiced relationships with their patients. This can be done by creating mutual trust and respect between both the patient and the nurse. The nurse can do this by discussing the patient's feelings about their care, encouraging the patient to express their fears and concerns. In turn, this will allow the nurse to correct any misinformation and gain a deeper understanding of the care the patient needs. Nurses can deal with the challenges of developing their competency skills and implementing holistic care by keeping up to date with current information and also ensuring that other nurses around them do so as well. They can do this by talking to their colleagues with respect, recognizing and understanding the separate and independent roles and functions of other healthcare team members. This is essential for those within the nursing profession, as nurses should always work within their field of practice, recognizing when others within the healthcare team are needed to make decisions and assessments.
As nurses are present with patients every step of the way, working closely, communicating and establishing a trusting bond, they are able to develop key listening skills and advanced understanding and intuitions about the needs of a person. Particularly in the delicate area of neonatal care, the integral aspect and more importantly, the understanding of person-centered care and the care environment prompted for health innovation which supported families during what may be a very difficult time. Using the basis of person-centered care, senior neonatal nurse practitioner Linda Coulter in the neonatal unit at the Countess of Chester Hospital proposed the initiative in order to improve the care of premature and sick babies in 2000. Coulter established a human milk bank to produce an alternative food source for premature babies. Over the next 11 years, it functioned through the charitable donation and grew to be the largest human milk bank in United Kingdom. Thousands of infants have been able to benefit from the milk, which has been donated over 1,500 mothers. Although this is costlier than formula milk, the final cost of the neonatal care will be decreased by preventing cases of NEC, necrotizing enterocolitis, which is a condition seen in the premature babies where portions of bowel undergo necrosis, therefore reducing the needs of surgery or intensive care. Babies who are fed on the donor milk rather than formula are 5 times less likely to develop NEC, consequently preventing a future lifetime living with the measurable disorder.
Coulter strived to provide a service that was beyond helping premature infants, by also arranging a support system for the mothers of the infants. After 2.5 years of further fundraising, Coulter was able to finance a women's counselling to accommodate women going through tribulation. The care environment was created by ensuring the appropriate conditions were made for the production of the milk. This was achieved by having necessary equipment to obtain and keep the milk, and working closely with paediatricians, hospital managers, and donors. In order to ensure the milk was risk-free, all donors had to undergo compulsory HIV screening. The donor milk was pasteurized to produce high-quality milk that was the best supplement available to the infants. The mental aspect of care environment was created by ensuring the needs of the individual patients were met, but also the needs of their family and community. Respecting and understanding the different mental support needs for each mother was established as an integral support system and was achieved through the form of women's counselling. Having counselling ensured both the patient, mother, and their family were recognised and understood, allowing the mother and family to share their views and deliberations throughout the process. By providing support for the mothers in need, Coulter ensured that person-centred care was implemented into the programs.
The inspiring story of Linda Coulter, a nurse whose innovative ideas have helped improve countless lives, implement a safe care environment, and ensured person-centred healthcare. The initiative was completely patient and family-focused and has benefited the context in which care is delivered. Preventing the loss of premature infants ignites a light of hope not only to the associated healthcare professionals, but more importantly to the entire support system of the families involved. Through distressing times, this particular type of care environment and person-centered care demonstrates its utmost importance in maintaining patient comfort and livelihood. It shows that healthcare professionals are not only obliged to treat their patients, but to also listen to them and account for their needs in a healthy care environment which brings them reassurance. In conclusion, person-centered care in nursing is to respect and understand patients with different wishes and backgrounds whilst protecting their rights and dignity. It focuses on patients' well-being by building a therapeutic relationship based on trust and understanding between patients and nurses. In order to create a therapeutic relationship, a positive care environment must be achieved through organizational values, industry standards, and a code of professional conduct. It requires nurses to be involved with patients, allowing them to address their current and future needs. Even though nurses face numerous challenges and responsibilities in facilitating person-centered care, they are expected to utilize their level of competency and decision-making to maintain and strengthen the trust and comfort with patients by implementing the best action plan. Nurses working towards the common goal of providing person-centered care in a positive caring environment are constantly seen throughout society today. One of the most innovative ideas was demonstrated by nurse Linda Coulter. Not only did she focus on treating her patient, but also the family and community of the patient, underlining the importance of the care environment for support and assistance.
Thank you for watching.